This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. We're outside the Aurora Medical Center in Oshkosh today. We've taken some time to walk on this beautiful walking path that wraps around the hospital. It's nearly a mile long and it's open to the public. Hi everyone, I'm Ted Stefaniak. Glad you could be with us today. We're burning some calories on this path, and that's really the subject of today's topic here on Focus on Health. We're going to be talking with Dr. John Newman. He's in charge of a medical weight loss program here. It's a little bit different, so if you're looking for a little motivation and something a little different to help you lose some weight, this might be the program for you. Well, thanks for taking some time with us on a beautiful day here, and being out around a walking path kind of gets you in the mood to get out and walk some steps and lose some weight. And you've got a brand new program here. Tell us a little bit about the name of the program and what it's for.
Well, thanks for the invite, and you're exactly right. When you look at a walking path, that's kind of the walkway, the activities, kind of the pathway to living well. Well, we've started a medical weight loss kind of program here, and it's all part of Aurora's commitment to living well. And when we really look at what are the things we need to focus in, and it's not just Aurora, it's all the health systems, obesity is one of the things that we just can't focus enough on. So our medical weight loss program is like everything else we do. We play to people's passions and play to their strengths. And so we've kind of harnessed a team with, and I'm fortunate to be on the team as a bariatric surgeon, but also as somebody who's spent my life dedicated to helping people fight obesity. And Michelle Medvich is our nurse practitioner that helps us run the program for the medical weight loss program. And as we work together, obviously the primary care team has been working on this forever with them, but they have asked help. They said, we would like to have some assistance for our patients that, especially not just for medical weight loss, but also for the diseases that are co-located with obesity, like diabetes, hypertension, and even cancer. So any efforts we do to help people control their weight are just going to pay off fold in improving their health.
So what's new about this program? How is this program going to help where other programs may have failed for people?
Well, I tell you what, I think that, when you look at the numbers, the Jenny Craig, the Nutrisystems, the Weight Watchers, all efforts, they don't have great numbers. And probably the only thing that's given the longest term solution for weight loss is surgical weight loss. But I will tell you that when people come to talk to us, that most of them are just not interested in surgical weight loss, but are very much interested in what can I do with them. And so what's different about it is the passion of the providers, with Michelle and myself just setting the relationship up. And so you probably the bigger question is, does it work, and why does it work? And so we're very proud to say it's working, that we're very proud with kind of the weight loss that our patients are achieving. But the reason it's working is because we've just now augmented what the primary care team has already been doing, augmented what all the other activities that people do in life to lose weight, and just bring it into the medical weight loss center and say, all right, let's focus a little bit. And it's based on education. Everything we do is education. When we look at, well, what can I do to get smart on weight loss? I mean, probably the most important thing is, do you know what kind of activity you're doing? When you go on a walking path like this, that as we sit outside Aurora, Oshkosh, with it's about a mile-long path, but that's about 4,000 steps when you break it in there. But you got to put your activity in congruence, and you also got to say, what am I eating? And so probably one of the biggest parts of this program that we feel like we make a difference is we just kind of relate with the patient, and they commit to keeping a food journal, and they commit to saying, I'm going to write down everything that I eat. And so every time that we see them in follow-up, we're talking about, here's what you're eating. And so often it was like, I thought that was healthy. And really sitting down and having the conversation, and it's like, we're not saying it's unhealthy. We're just saying that if the objective here is to burn fat, then certain things we need to not be eating. And we say this time and time again. We talk about processed foods and simple sugars and sweet drinks and beer. I mean, we're in Wisconsin, but I can't swing a dead cat with somebody handing me a spotted cow, and it's like, this is great. But I tell you what, we got to do it in moderation. But more importantly, we just have to know how much carbohydrates we're actually ingesting.
So obviously it takes a lot of work, and you know, a lot of times people aren't so interested in writing a journal, but that's a very important part of it. How much does exercise come into play as well?
Well, I'm not going to let you off the hook on the writing the journal, because when we look at our patients who actually write in their journals and the ones that don't, as far as their food logs, the ones that actually keep the food log lose twice as much weight. But if you don't write down in the food journal, quite honestly, you just don't know what you're eating, you know. But the activity is huge. And so when you talk about the activities, what you're trying to do is an activity that helps you burn fat. So if you and I were to sprint, you know, that requires sugar. So for sprinting, yeah, we got to look to our bodies and our livers and our muscles for the sugar. But if you and I just walk, or actually better yet, if we walked where we're in a brisk walk to where we're just almost winded talking to each other, that's perfect. When you're not jarring the body, you're not hurting yourself, but you've entered that aerobic phase that your body's going to start seeking out, how can I burn some fat to give you the energy to finish this exercise.
We've only got about a minute left. Who are the people that should be seeking help for weight loss? I always try to lose a few pounds, and I think if I were to get checked out right now, I would probably be considered obese. I don't feel obese, but I think from a medical standpoint, I would be classified as obese.
You know, when people ask me and they say, hey, these numbers are a little strict here. With body mass index is a very standardized number we run off of. If you pull out your smartphone or computer and say, what is my body mass index? It's a height to weight calculation. And again, I'm not too heavy, I'm just not tall enough.
Yeah.
But the calculation
so you just need to grow a few more inches. Yeah.
So, but since we're not getting taller once we get to our age, and really that body mass index 30 and more, once you get above 30, then that's a definition obese. And it's not a definition based on anything other than when we look at the graph, that's where people start having medical problems from their weight. When they get to be morbidly obese at 40, that's when people start dying because of their weight.
Okay, so you should be always working with your primary care provider to see where you're at with your weight and various tests, but can they check with you right away then, or do we need to see our primary care provider before we come see you?
Everything we do in conjunction with the primary care team, but I tell you what, coming to kind of Aurora Medical Weight Loss, you can come see Michelle Medvich, you can come see myself. With predominantly I work on the surgery side, but like I was saying, half the patients that I get, they say, I'm not interested in surgery, let's talk about medical weight loss.
Takes some work though, doesn't it?
But it's the rest of our life work. So it's not something I'm going to give you a month's effort. This is the education and the discipline we need to generate for the rest of our lives, because it ain't getting any easier, folks.
No, and that's the reality of it. Hey, we appreciate you taking some time with us today.
Excellent. Thank you for your time.
Now, hopefully you're checking in with your primary care provider at least once a year and you have an idea of what's happening with your weight situation. If you have some questions or you're just looking for a little more motivation in weight loss, be sure to give Dr. Newman a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.